Ranvir Singh Johal is a Valley native who just completed his first year of medical school at the CHSU College of Osteopathic Medicine. He attended the Doctor's Academy at Carruthers High School, sparking his interest in medicine and introducing him to real-world experiences in healthcare. The challenging curriculum prepared him well for his undergraduate work at UCLA, where he earned a bachelor's in biology. Before medical school, Ranvir worked at the Central Valley Health Policy Institute, a job that gave him more insight into the many healthcare challenges that lower-income Valley residents face and the impact that healthcare providers can have in lobbying for policy changes to improve their circumstances. Ranvir's Sikh parents immigrated to the U.S., settled on a farm in the Carruthers area that was worked by extended family members. His dad is a truck driver, and his mother works for Sunmaid. With parents who spoke Punjabi but little English, Ranvir knows firsthand of how to communicate and how the gaps happen and can affect medical care. This gap is among the many reasons he's back in the Central Valley, where he hopes to practice medicine after medical training. I'd now like to introduce to you Ranvir Johal. Let's give him a big round of applause and welcome him to the stage.
Hello, everyone. Thank you for that brilliant introduction. That was much better said than I could have done. First of all, I'd like to thank Rochelle Kleiser and CHSU Com for allowing me to share a bit about myself and my experiences, both as a Central Valley native and as a CHSU medical student. I was actually just talking to my sister about how usually the medical students, when they have these like fancy galas and dinners, that we always stick around waiting for the food afterwards. So it's nice to be a part of the gala and get the food while it's still warm. So thank you for that. And as Mr. Powell mentioned, my story actually starts with my parents who immigrated to the United States from Punjab. And they settled here eventually in the Fresno, California area, where they decided to do what their families had done for many generations before them in Punjab, which is farming. And growing up on that farm, it kind of laid the foundation for the future medical student that I would eventually become. And I didn't know it then. I probably didn't appreciate it as much because I was much more of like an indoor kind of person. I liked having my nose in a book, but it definitely learned a lot of valuable lessons. And additionally, it helped me to kind of bridge that gap between me and my elders doing the things that they had done for many generations. And it bridged that generational gap that I'm sure many children of immigrant parents can relate to. And my passion for medicine, it was actually kindled as a part of the UCSF Fresno Doctor's Academy at Carruthers High School. That program was incredible because it allowed us many interactions with various other health professionals, not just physicians, and it truly helped to bridge that resource gap that we're all very familiar with, and it's especially prevalent in the rural high schools in the Central Valley. And for me, it personally gave me a community that has been alongside with me on my journey, even now into medical school. My time away from home at UCLA was also very incredibly enriching. However, it really emphasized how much I missed the community that had formed here in the Central Valley. I especially missed my support system and the sights and sounds of living on our farm. So you could probably imagine my excitement when I heard about these California Health Sciences University. It's so special to be able to attend a medical school in an area where the physicians are practicing where I grew up. And I could not have really known how special it was going to be until I eventually started here. My first year at CHSU, it's been a long ride, but it's been incredible. I've absolutely loved the team-based learning format that we have here because my team has some of the brightest and most driven individuals I have ever met. It was very intimidating at first, but fortunately, they are also some of the kindest and funniest individuals that I've ever met, and that really helps because medical school can be very chaotic at times. The community here at CHSU has been so supportive, and it's actually one of the things that I brag most to about not only to my friends in other medical schools, but to future students who are accepted here. We often, as ambassadors, we talk to them, and I consistently brag about not only my classmates, but the second and third years, and even the faculty who consistently make the time and effort to talk to us and spread their knowledge with us. And fun fact, we actually have an accepted student here in attendance today, so bonus points if you guys could find her. There have been many challenges as well. The financial burden was something that I was aware of it, but it did not really register until I saw my statement on my account for the first time. So for that, I'm very grateful for the financial aid team here at CHSU. They've helped not only quell some of those fears that I've had about taking out such large loans, but they've aided me thoroughly in that process of acquiring loans and just knowing what my options are. Additionally, I'm also very grateful to be a recipient of the California Health Sciences University Scholarship Fund, specifically as a recipient of the California Health Sciences University, on behalf of the Central Valley Community Foundation. Not only has it eased some of the financial burden that comes with attending medical school, and taking out such large loans, but when you're studying and you're trying to decide what resources you need, whether you want to go across the street and get a Starbucks coffee, it can be very mentally taxing knowing that you're only furthering that debt that we have to endure. So having this scholarship brings a peace of mind that has been much more valuable than the actual money or the monetary value that it comes with. And for that, I'm very grateful. As for my future, no matter what specialty I decide to pursue, I know that as a physician, I will have the privilege to positively impact the health and lives of the individuals of the Central Valley. And however, I am more excited now, more than ever before, about all the opportunities that lie beyond practicing medicine. I have learned so much in the past year about all the good things that are already being done here in the Central Valley, especially hearing from our faculty, a lot of our clinical faculty who practice in the area, hearing about all the amazing research that's being done by our faculty with a specific focus to our region, and even the students here at CHSU who are creating new initiatives to go out into the community, and they've been so well received by the community. So having learned from this environment, it really makes me excited to see all the doors that will be open in the future. I know that being in this environment will only fuel the passion for public service and community organizing and continue to open doors to many opportunities in the future. This strong sense of community that supports and surrounds CHSU has been really wonderful to see. Being a student, I wasn't very aware of it, but coming out here, seeing the support that we have, it's very heartwarming to see. So thank you all for your attendance and your support and presence here today. I'm genuinely in awe of how many folks work towards the same goals that CHSU also strives towards. So I sincerely appreciate the time that you've dedicated to being here. It's been an absolute pleasure. Thank you.